Hi judges, my name is Sia and today I'm here to present my project Neuroscope 360. One in every 100 individuals, totaling 24 million people worldwide, are diagnosed with schizophrenia, yet nearly 33% of cases go undiagnosed. Early symptoms mirror other life changes that occur with age, sleep disturbances, stress, and chronic substance abuse, which making it difficult to differentiate from the debilitating disorder. When individuals do go to a clinical setting, misdiagnosis rates are as high as 50%. This issue is particularly prevalent in marginalized communities, where racial and ethnic minorities are more likely to misdiagnose due to biases and limited access to specialized healthcare. And individuals from low-income communities are 2 to 3 times more likely to develop schizophrenia due to chronic stress and environmental influences. The difficulty in diagnosing schizophrenia lies in the fact that there is no single biomarker or comprehensive diagnostic test for which it can be detected. A full diagnosis requires a physiological examination, neuroimaging scans, and an in-depth family history analysis. This difficulty in early diagnosis has caused patients to go undiagnosed for 2 to 5 years after the onset of the disorder, meaning 80% of patients have experienced significant brain volume loss and severe symptoms before treatment. The long-term consequences are a shortened lifespan of 10 to 20 years due to untreated physical health issues and suicide. As such, advancing early detection could revolutionize treatment outcomes. That is exactly what my project aims to do. Neuroscope 360 addresses the barriers in early diagnosis by developing an integrated machine learning-based diagnostic tool that leverages publicly available biomarker data to improve the accuracy and accessibility of diagnostic methods for early detection. The analysis of the objectives of the project and in-depth research on the functions of various machine learning models, it was determined that 3 machine learning models would be used: a linear regression model, a logistic regression model, and a convolutional neural network. Regression model parsed valid data, categorized it into features and labels, and created linear relationships between biomarkers, leveraging this to indicate the strength of relations between schizophrenia biomarkers through a linear update function on the screen. The linear regression model was trained on the blood samples of schizophrenia positive and negative patients and identified the 10 most indicative blood-derived biomarkers in a two-dimensional weighted matrix with the gene-gene correlation depicted here on the screen. The analysis identified the strongest correlations between these genes depicted on the screens, with their descriptions also on the screen here. The logistic regression model used continuous data to predict a binary outcome, transforming the linear relationship between the schizophrenia biomarkers and the presence of schizophrenia through a sigmoid function, depicted on the screen to the left. Trained on the same data as the logistic regression model, 10 independent trials were run with the accuracy score and confusion matrices on the screen to the right. The final average score of 92.3% accuracy was computed. Lastly, MRI data of 66 schizophrenia positive and negative patients were collected, and I employed a CNN model with an emphasis on avoiding overfitting to diagnose these patients based on the imaging data as the sample image on the left. The model, similar to the logistic regression model, produced binary classifications through a sigmoid function with a 66% accuracy. Although this appears low, it aligns with the average accuracy scores of current MRI scans. The final diagnostic tool was an integrated model that equally weighed the logistic regression and CNN model predictions. Each model produced continuous predictions that were then averaged and compared to a threshold of 0.5 to produce binary classifications. Combining the two previously used data sets, patients were simulated to test the model, which produced an 100% accuracy as depicted on the screen here. Much of my time after creating the skeleton models was spent on hyperparameter modifications to optimize model performance. The greatest limitation I faced was data collection. There's very limited publicly available data on schizophrenia patients for privacy reasons. As such, the two public data sets I used, although suboptimal in size, were the most relevant data sets I could find after months of research. Multiple months were also spent pre-processing the data, including removing sparse values, undersampling, and randomizing to mitigate bias, preventing overfitting, and transposing data. This significantly improved the efficiency and the performance of the models. By utilizing machine learning, Neuroscope 360 enhances the diagnostic accuracy, accessibility, cost efficiency, and scalability. By analyzing a panel of biomarkers as opposed to just one, it creates a novel and personalized approach to an accurate early schizophrenia diagnosis. This early detection ultimately allows for early intervention and improved treatment outcomes in schizophrenia patients. By integrating logistic regression and CNN model into a larger integrated model, the tool allows for the flexible weighing of blood and neuroimaging markers, adapting to patient-specific factors such as substance abuse and sleep patterns. Furthermore, the linear regression model results demonstrate that an effective diagnosis can be made with a sparser data set with key biomarkers. Reducing the number of biomarkers that the model is trained on may also slightly lower accuracy, It significantly lowers processing costs, making the diagnostic tool much more affordable and accessible, particularly important for low-income communities. Thank you.